Hooded eyes are such a common concern that we see in clinic, but what can be done short of surgery to address this hooded appearance? Because actually hooded eyes do make us look tired. They make us look older than we might be. They can also cause functional problems. So for some people, the upper eyelid can become so hooded that it actually sits on top of the eyelashes and presses the eyelids down. So this can actually be quite a significant problem. Why do they happen? Well, there's a few reasons. One is that as we age and we lose collagen, we get an increase in skin laxity. So that more lax skin doesn't sit as neatly as our eyelid does in youth. But there are also structural changes. So the fact that our skull shrinks as we age means that the skin around the periorbit around the eye is held less tightly than it once was. And so you have less tension through that lid skin. So thinking about those volumetric changes can make a difference when we're thinking about treating the upper eyelids. And we can also get changes in the balance of our muscle strength. We can become stronger in the muscles that pull our eyelids downwards and weaker in the ones that cause our eyebrows and eyelids to lift up. And so those muscle balance shifts can also contribute towards a heavier appearance on the upper eyelid. What can we do about it? First and foremost, I would always say make sure you're using a good eye cream, and there are some excellent eye creams around. They're not going to be a fix-all for everything, but are they going to make sure your skin is in optimal health and that any crepiness is improved? Yes. They're not going to address significant laxity, but they're still a crucial part of a routine. When it comes to non-surgical options, what could we try? Well, we can try some wrinkle relaxation. So when I talked about the causes and about muscle balance problems, often when people have wrinkle relaxing treatments, they have their forehead treated, and this can actually make us heavier on the eyelids rather than looking more lifted. So this is because of those shifts in muscle strength that I was talking about. Often when I'm assessing a patient and they might come in with these fairly pronounced lines that run horizontally across the forehead, it's because they're walking around raising their eyebrows a lot to lift that heavy eyelid off the eyelashes. And so if I go ahead and I treat those forehead lines with wrinkle relaxation, I make the problem worse, not better, because I reduce their ability to do that. So they end up looking more tired and looking older and more hooded. So when we treat with wrinkle relaxation, we treat in this frown area, which helps us to lift, and we treat around the side of the eyes and maybe around the tail of the eyebrow. And that can give maybe a 1 to 2 millimeter lift on average, which is enough to give many people a little bit of brightness around the eye. Soft wave is another excellent option. So soft wave uses ultrasound to tighten the skin, and we can really treat quite nicely around the eye by pulling up the skin around the eye onto the bone and treating it with ultrasound. And on clinical studies, that's shown about a 3 to 4 millimeter lift on average around the eye and eyebrow area. So again, that can be quite significant for a lot of people. Fillers can also be useful because when we treat within the cheek area and within the temple area, and in some people also within the forehead or the brow tail, we can restore volume where it's been lost to help optimize the brow position and the tension through the skin. So this will only work if on assessment those changes in volume have been a driving cause for you and the change in the appearance around your eye area. So it's not necessarily for everyone. And of course, there are other devices as well. Not all devices can be used around the eye, but the Age Jet can be. The Morpheus 8 can be for some people. So in the hands of an experienced practitioner, many of these devices can give nice improvements around the eye. Just so happens that I think for this area, for lifting, the best one is soft wave. We can also combine all of these techniques, or whichever ones are appropriate. And this is where assessment is so important. Being in the hands of an expert practitioner who really understands the treatments they're doing and what results they're going to give will optimize the results you can achieve. And often that might mean a combination of all or some of the treatments I've just mentioned. And we have to remember that there will always be patients who need surgery. This is a complex area of the face, and a blepharoplasty and upper blepharoplasty is an extremely effective procedure that remains the gold standard for heavy hooded eyelids. It's probably the procedure that I refer most patients for if I'm referring to a surgeon, and it's certainly one that if and when I need, I will consider in the future. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.